Hello, friends, and welcome to another episode of the Concussion Nerds podcast. And today I'm coming to you from my clinic. We just finished an intensive week, and more relevant to this podcast, I just returned on Sunday from Iceland. P.S. I have to go back. It was the most beautiful place I have seen in my limited travel experience, but it was stunning. But I was actually in Iceland for a specific reason. It was the Neck Care 2025 conference. And I was a speaker on the expert panel speaking about concussion and return to sport after concussion. So it was an honor to be part of the conference, but also to just be surrounded by amazing humans who are forward thinking in this rehab space and a mix of professions. There was physical therapists, chiropractors, upper cervical chiropractors, physicians. It was amazing. Now, Neck Care has actually been on our podcast before. So before I dive too much deeper, I'm going to pause for 1 second. This month, on May 30th, we are teaching Rethink Rehab Live. This workshop is for clinicians specifically who are ready to up-level their confidence and their clarity in working with complex concussion to have epic changes sooner in their clients' lives. So if that interests you, just click on the link below and you can learn some more. But we're going to talk a little bit about the neck in this episode some more because I just came back from a neck conference. So let's do that. So here's the thing. So Neck Care is a device that we've been using in my clinic for the last year and a half-ish. And it is, I'd say prior to Neck Care, challenging to get consistent, reproducible outcomes, right? I don't know about any of you, but for the physical therapists listening to this, I absolutely despise using a goniometer to measure neck range of motion. Like, oh my goodness. Right? So Neck Care is a device that has been tried and tested, and it allows us to look at three things specifically at this moment. It allows us to look at neck range of motion, joint position sense, and something called the butterfly test, which is ultimately looking at sensory motor control and how your eyes and your head coordinate together. And everyone is loving it. And the data that it gives us just gives us greater insight specifically into some of these phenotypes of concussion as well, or neck pain, or whoever works with the neck, to be honest, to help us with treatment. And so here's what I see a lot in the concussion space. And we've talked about this before. We all have our biases, right? Vestibular therapists love to start with the vestibular system. Vision therapists love to start with eyeballs. Manual therapists tend to like to start with the neck. And so we all definitely have our bias. But with concussion, we need to be taking a multi-systems integrated approach. And the order in which we do things absolutely does matter. I remember when I was building out the Concussion Nerds curriculum, I was reading into a bunch of studies. They were saying, if there's the visual system or the vestibular system, like the neck can help compensate for these other systems. But if the neck is a big issue, the other systems can't do the same job at compensating for the neck. And the big piece that I will say I hear clients talk about is we need to look at what treatment for the neck actually looks like. So often, I will say people's stories, they see a really great manual therapist or a chiropractor or an osteopath, someone who's going to work with the tissues, right? We know that if we can palpate through that neck and we can hit a point that the client's like, oh my God, that's the ice pick behind my eyes, right? We can have a lot of referral patterns from the neck that can be the root of this blinding, painful headache, for example, that our clients are having. If you can palpate a muscle and reproduce the ice pick headache behind their eyes, you've found what you need to be addressing, right? You need to treat the neck, treat those muscles and help release that tension. But there's a piece that gets missed, and a part that got spoke a lot about at this conference, which we've been doing here at Symphony for years, and many people are, is this concept of sensory motor control and joint position sense. So there was more research kind of shared on it this week, and I don't have all of my notes in front of me, and I truly wish I did. But so often when we're looking at the neck, we look at the tissues, we look at range of motion, and when all those are clear, let's say, or someone's back within a normal functional range of motion, they're not complaining of pain, or, your palpation's fine, then that's where people stop. And that is when we need to go this next step further. And in truth, I'm going to talk to you about how I think treatment does and how we do it here. But in truth, that is step one, because now there's this piece that we need to look at. Does the person know where their head is in space? We have more muscle spindles and joint proprioceptors in our cervical spine and our upper cervical spine than any other part of our body. Like, let that sit for a second. Our suboccipital muscles are small, like especially when you compare it to something like a quad or a glute or something like that. And they have the densest amount of muscle spindles than any other part of our body. And obviously, sometimes with injury of concussion, with the whiplash that accompanies it or whatever it is, these inputs get damaged. And so our head doesn't know where it is in space. And if that happens, that can lead to feelings like dizziness, disorientation, floatiness. Things don't coordinate well together. We don't have good motor control. All of these pieces can come into play. And so we need to be also looking at and testing, do we know where you are in space, aka a joint position sense test? And what does our motor control look like? What does the quality of our neck movement look like, right? If we're rotating, are we actually rotating? Or are we using a lot of extension to help us get into that rotational piece, right? Like these things matter. And so a lot of the times clients will be like, oh, I've had my neck treated, my neck is fine. And usually my response is like, let's just look a little bit deeper at this. And while they have good range of motion and they're not complaining of neck pain and palpation wise might be okay, when we start to look deeper at, does the position of your neck impact your eye movement or eye stability? And I see that it does. That's a problem. When I do joint position sense testing, do you know where your head is in space? If they don't, that's an issue. Do you know how to properly recruit muscles to have smooth quality of movement? So these are I would say, the next 3 steps that we need to be in looking at in our cervical spine exams. And I'm going to say in anyone who assesses the cervical spine, not just concussion. In terms of concussion, though, some of the findings that kind of came from that were shared at this conference, and we're going to tweak our own neuroperformance testing for this, to be honest, and our own baseline testing, because there was a study done for male rugby union players. This was published in 2022. And this group used cervical proprioception as a risk factor, or they used it as part of their baseline test. And what they found was that poor cervical proprioception was an increased risk factor for these professional rugby players to sustain a concussion. So it was a modifiable intrinsic risk factor for concussion in professional male rugby players. So when we talk about baseline testing as a whole here for a second, it's so much more than just the cognitive testing. We need to be testing when, in my opinion, you're looking at the full neural performance of this person. How are all the systems working? How are they integrating? And you get to take the information from that to decide, oh goodness, we can do a program to increase your just overall function. And this group found specifically that poor cervical proprioception pre-concussion actually put them at increased risk of concussion. And that's something we can treat fairly easily in clinic, right? There was another study that looked at using cervical spine proprioception for adolescent concussion. And the conclusion was that adolescents with concussion demonstrated worse cervical spine proprioception than uninjured controls. Head repositioning accuracy may offer diagnostic utility for subacute concussion. There was another study that was shared that looked at joint position sense in a more elderly population being linked to potentially increased fall risks, right? So if we don't know where our head is in space, that's going to impact a lot of pieces. And so if you are a physical therapist, a chiropractor listening to this, and you are working with somebody in any capacity with the neck, so if you're working with concussion, you cannot ignore the neck. You cannot. But if you're anybody who works with the neck, yes, do your range of motion testing. Yes, do your palpation skills, look at joint mobility. And then you must also please look at joint position sense and sensory motor control and quality of movement, because those pieces, if they are prevalent, put the person at increased risk of cervicogenic dizziness down the road or things like that. I will say, from one of the things that I loved that got talked about, I know that we have normative ranges, okay? I know that no one is perfect 100% of the time with 100% accuracy. But when I assess my clients and when I work with my clients, my goal is not, we're just going to get you to the 50th percentile norm. That's not my goal. My goal is we are aiming for gold. We are aiming for 100%. Do we need to make it? No, but like that's my goal. And so one of the speakers, our keynote speaker, talked about what is the actual level of joint position error we should be aiming for. What are we accepting as okay and normal and non-pathological, as in the sense that it's not going to have an impact anymore if it was more or less. And I loved it because she made the comment that today in the literature, people say that about 4 degrees is acceptable. And she's saying, I think we probably need to bring that down. And that's not good enough. And it just made my little heart happy because I want to see accuracy and precision consistently. I don't want to see it 50% of the time. I don't want to see it 2% of the time. I want to see that you know where your head is in space consistently with precision. And so if you are someone on a healing journey listening to this and you're like, no one's kind of ever looked at that in my neck, then that may be something that you need to consider depending on some of your symptoms. So let's talk about, from a clinical perspective, what are some of the tests we can incorporate in our physical exam to determine the presence of neck involvement. Okay. So, yes, range of motion. Yes, palpation. Yes, joint play. We use the swivel test, otherwise called a sustained torsional test, I believe. So this is where we hold the client's head stable, so that way the head doesn't move. So we have no vestibular input. We don't have to worry about any of that. They sit on a chair or a stool that moves, and they torsion their body below their stable head to the end range that they can take it, and we sustain that hold. And we ask them, do you feel the same, better, or worse than when we were looking straight ahead? Ideally, the person feels the same. But if they start to complain about nauseousness or feeling off, or they might feel floaty in this position, that's a flag for you that you're going to want to look closer at the neck. And then you come back to center, and then you're going to let them ground and settle, and then you're going to test the other direction. Specificity matters, right? And you're going to see the same thing. Do you feel the same, better, or worse in this position? Okay, that's one test. Another test you can look at is the smooth pursuit neck torsion test. So what this one is looking at eye movements in neutral. So what does smooth pursuit, horizontal or vertical, look like in a neutral plane? Then you can either have them rotate their head or you could torsion their body like they just did. And then you have them repeat the smooth pursuit. And does the quality of the eye movement look the same or worse? If there's an integrative component with the neck and the eye movement, you're going to see a breakdown in some of that eye movement. So that would be a positive indication that there's an integration issue or something happening within the neck and the eyeballs, and the neck might be actually driving some of the ocular motor challenges that you're seeing in your client. Also, you could look at the cervical flexion rotation test. So this is where someone is supine, you bring them into that kind of isolated cervical flexion and then elements of rotation. And there are statistics that show, I don't have them in front of me, I'm so sorry, but talk about what the restriction of range of motion is for someone with likely cervicogenic dizziness. In that piece of it, we also do some testing with sustained torsion in our VOG with fixation removed to look at what happens there with the neck. And then obviously we do joint position sense testing. And then we do head-eye coordination testing and the butterfly test. So are the eyes able and the head able to stay in sync in a one-to-one pattern as we rotate eyes and head together? So those are some of the tests if you're looking at, is there a cervical involvement, or could the neck be a component that is contributing to some of the eye movement I'm seeing? Those are some of the tests that if you're not already doing those in your clinical exam would be very beneficial to be adding to your clinical exam so that then you know that you're going to be looking at that upper cervical component of the neck, that piece of it. This doesn't even include like neck strength should be in there too, to be honest. But ultimately, as a concussion clinician and as a concussion provider, we need to be including the neck. We just do. When you look at the mechanism of how concussion happens and that acceleration, deceleration injury, for most cases, the amount of force to sustain a whiplash injury versus the amount of force to sustain a concussion is significantly less for whiplash. So that would lead us to believe that should we actually have enough force to sustain a concussion, the neck was also impacted. And we don't want to let that be untreated, right? I have so very much fall into this camp that if you sustain a concussion, you're connecting with a provider on day 3 or 4. And as the provider, you are screening all those systems in that first appointment or 2. So while, yes, you're getting them moving because you know aerobic exercise is so important, you're also screening these other systems and you're going to dive into treatment then. You're not going to wait 10 or 14 days to see if symptoms resolve and then implement treatment. If you see an issue, address it. Let's be proactive, not reactive in our approach to our concussion care for our clients. So ultimately, we must address the neck. For so many people, it's that we just stop before you should. So there's just kind of this next step that we need to be taking in our neck rehabilitation that a lot of people are forgetting. Those are a few of the clinical exams that you can use to do it. And if you are interested to know more about neck care, feel free to drop me a message on Instagram or send me an email. I'm happy to answer. If you already know you want neck care, you can actually use the code NERDS and you will get a little bit of a savings. I'm a huge fan of it, so I will happily share more about it as well. And if you've ever considered going to Iceland, I highly recommend it. I love waterfalls, and I saw 3 of the most gorgeous waterfalls I've ever seen in my life. They were beautiful. I also love anything to do with water, and the Black Sand Beach was amazing. There's so much of that country that I didn't get to see because I had a limited time while I was there. So I will absolutely be going back. And I met, again, just some amazing, amazing humans at this conference. Collaborative minds, forward thinkers. And it's just so refreshing to be in an environment like that, that if you are ever considering a conference in the future, keep your eyes out because it's one I would consider as well. All right, my friends, I'm going to wrap it for today. Just finished an intensive week, heading to enjoy some time off next week. But until next time, I'll see you soon. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.